Have you been told your hip replacement is simply the only option when your joint wears out? What if the real reason for your hip pain is shaped by your entire skeleton and not just your hip alone? Hello and welcome to ScanAlign here in Harley Street, London. I'm Nahid Chowdhury, a radiographer with 15 years experience, examining more than 30 patients a day. Over the years, I've been privileged to witness patients' journeys through all their challenges, from the beginning to recovery. Now, I want to show you how we can help you use EOS to look at your whole body and understand hip replacement in a completely different way. If you've already seen clinicians and still don't have the answers, stay with me. You're about to see how the bigger picture that could finally bring you clarity. First, discover how EOS reveals whether your hip replacement is linked where inside the hip itself, or if a misalignment elsewhere is adding to the strain. Next, see why traditional scans, often done lying down, might miss the very issues that affect your hip when you're standing and moving. Then, uncover how a single EOS scan shows your entire skeleton, standing and weight bearing, so you can finally see how your spine, pelvis, knees all interact together with your hip. Finally, we want to understand why consultants trust EOS for planning and follow-up of hip replacement, giving both you and the surgeon a very clear roadmap. This sets the stage for understanding how your journey with hip replacement can be supported at every step. If you're facing hip replacement, you've probably tried physiotherapy, injections, or even lifestyle changes, yet the pain continues. You don't just want another quick fix. You want clarity about what's really going on. Your body works as one system. A tilt in your pelvis, a curve in your spine, or even a misalignment in your knees could be placing extra stress on your hip. EOS reveals this relationship in a way no other scan can. If your hip replacement feels like the only option left, EOS can show you not just what's been happening inside the hip, but also the underlying reasons why your hip has reached this point. That insight can help protect your outcome long after surgery. This highlights why whole body clarity is essential for hip replacement decisions. Traditional scans like X-ray or CT are usually done lying down. The problem? When you lie down, the weight and tension that shows the real alignment completely vanishes. EOS is different. It scans you standing with natural weight pressing down through your joints. In just one scan, you see how your spine, hips, pelvis and knees works together under load. This isn't just about looking at a single point of pain. It's about seeing how your whole skeleton is moving in a way that you actually live in. That makes all the difference when preparing for hip replacement. Now that you can see why scanning position matters, let's compare how EOS stacks up against traditional methods. To get the same detail EOS provides in one scan, you would need around 14 separate X-rays, or a CT scan, but would require 20 times the radiation. EOS avoids both of these problems. It delivers a single standing scan in about 30 seconds, using only 90% less radiation than X-ray and up to 95% less than CT. That means a safer, faster and more accurate results, trusted by consultants for hip replacement planning and follow-up. This shows why EOS provides unmatched detail for hip replacement. Pain rarely just sits in one place. Your skeleton acts like a chain, one affecting the other. A hip problem may strain your knees or your lower back. A knee issue can travel upwards into your posture and your balance. EOS captures your full skeleton, standing and weight bearing, side to side, front to back in one scan. The alignment data makes the hidden causes of your symptoms plain to see. That's why EOS is a crucial step in your hip replacement journey. So, let's see how this fits in the way consultants work in the UK. In the UK, consultants are highly specialised. Some work on the spine, some on the hips, some on the knees and some on the feet. This deep focus is a strength, but it can also mean they're missing the bigger picture. This is where EOS is different. It gives you a whole body view in one scan. When our doctor reviews your results, you can get an unbiased interpretation based only on the evidence. There's no agenda, no financial reason. With this clarity, you and your consultant can focus on the true root cause, not just the visible symptoms. For hip replacement, that clarity could mean better planning and greater long-term success. This shows how EOS empowers you before hip replacement. EOS is more than just a scan. It's a way to understand how your whole skeleton works together. By showing your body and its alignment in a single standing image, EOS puts control back into your hands. It shifts you from being a passive patient to an informed partner in your own health journey. With EOS results, you and your consultant can then make hip replacement decisions with clarity and confidence. This gives you the certainty you've been searching for. So, let's go for a quick recap about what EOS can do for you. A full body standing image, accurate measurements of your skeleton, 3D reconstructions of your hips, spine and lower limbs, all done with ultra low radiation. All of these give you the knowledge to move forward with hip replacement as one of the most informed patients that you could be. So, if you're tired of the long struggle with hip pain, arm yourself with the clarity of an EOS scan. Book your video consultation today and take the next step towards confidence in your hip replacement journey.